What's unique about total knee replacement surgery at Riverside Orthopedic Specialists in Gloucester is that we have every patient come into the office. Before we even get to talk about surgery, we already have treated that patient with conservative management. We take care that they go through a therapy program. We may do some injections, so we don't just jump to surgery. Now, if the patient does require surgery, we talk about the different options that we have for knee replacement, which sometimes could be a partial knee replacement, sometimes could be a complete or total knee replacement. This is a model of a complete knee replacement. It's not a uni or it's not a partial, this is a complete. So we have replaced or resurfaced the medial, this side, the lateral for a right knee, and then the patellofemoral compartment. So you can see that there is metal here on the shin bone or the tibia. And then in between the two metal pieces, there's actually plastic. We also try to improve the extension, which is, this motion to make it straighter, and also the flexion. It's important to know also that over time, as the arthritis gets worse, you tend to lose extension and flexion. And that's one of the things that I always tell our patients, that keep an eye on your flexion and your extension, because the more flexion and extension that you lose before surgery, the harder it is to get it afterwards. So a total knee replacement surgery, it is a fairly big surgery. However, the risks are there, but the outcomes are much greater, and the benefit outweighs the risk. I would say probably the majority of my patients, more than 85 to 90% of my patients, go home the next day. With this multimodal anesthesia program that we have at Riverside Walter Reed Hospital, it is a great thing that has changed the way we deliver care for our patients. We get the patients home, and there's no place like home. The next day after they get home, we'll have a whole therapy team that shows up. They'll have a physical therapy team, but they'll also have a nursing care team. So the value of having your total knee replacement here at Riverside Walter Reed Hospital is essentially it's a whole package. It's not just the surgeon that's doing your surgery, but the whole team. I've been here for about 12 years, and I tell you that I've been seeing this local community hospital grow into something that's super high tech. We have great therapists that would take care of the patient right after surgery. That afternoon, they'll be getting the patient up and going again, and with the goal of getting that patient home safely the next day. In terms of recovery after total knee replacement surgery, it's a little different for everybody, but on the average, it would take 2 weeks to come back to see us in the office, and that's going to be to check the incision, make sure that the patient doesn't have an infection, and make sure that they have their range of motions coming along. Usually it takes, they're walking right away, so they're walking the same day. They'll be using a walker by the time they get to the office. They'll be on a cane or maybe nothing, with the goals of being pretty much independent by a month, driving hopefully by a month. And in terms of going back to regular activities of daily living and sports, some patients that even at a month, they're already golfing. I have some that I even at 2 weeks were golfing, which I don't recommend for everybody. But for the most part, it takes several months to recover fully from this. And most patients say between 4 to 6 months is when they really see the fruits of their labor that they went through with physical therapy.